Hey, everybody. Lieutenant Joe Pangaro here today. We're going to talk about an interesting aspect of safety and security that I haven't gotten into too much. I haven't spoken too much about it. Now, many of you know one of the things that I do is I do threat assessments and I do safety and security training for schools, businesses, uh, religious facilities, any place people gather that they need to be safe and secure. That's what I do. I go out there and try and help people understand that safety and security element. Well, recently I did an article about the dangers of workplace violence in healthcare locations. This would be clinics, hospitals, doctors' offices, and it was surprising to me to realize how many times there are incidents of violence in these kind of working locations. I just never thought there would be that kind of a situation. But it turns out that there actually is. And from what I'm told, since the pandemic, the number of incidents have gone up, and it's something we all need to be aware of and take a good look at. So today with me, I have an expert, an outstanding professional with me. I'm going to read a little bit about our guest here. I wish there was a drum roll, ding or something like that. I'd say, hey, I would like everybody to meet Christopher Slocum, and he's got a host of credentials: MSN, RN, CMSRN, which sounds like his initials. We just went over that. Christopher is a nursing professional practice specialist and workplace violence manager in UMass Medical Center's Department of Nursing Education. Christopher, welcome aboard.
Thank you for having me.
That's quite a list of certifications you have here. So why don't you tell us who you are and what you've been all about, and I'll go over these letters individually so everybody understands who you are. But tell us who you are. What are you doing?
Well, thank you, Joe. So again, my name's Chris Slocum. I'm a nurse by practice. So I've been in the field for just over 10 years when I became a nurse, and I loved working at the bedside. Taking care of nurses in an acute care environment. So people are acutely ill. They've just been in the emergency room and now they're being admitted in a hospital. So I actually did that for several years and really getting my experience. When I look back now on it back then, there was a lot of situations of aggression and hostility that in our profession, we just kind of made it part of the everyday. It was just expected that people were having a bad day, and that's that. Too bad. So I worked for about 6.5 years as a regular floor RN, and then we moved on to getting an opportunity to work in nursing education, and that's where the MSN in my name came from. Before the MSN, I was ASN, and then became BSN, and then moved on to MSN. But us nurses sound funny when we keep adding the credentials on, so I just went with the highest of the three. So I got the opportunity to work in nursing education. I was like, this is gonna be really cool. And then the hospital network I work for said, you know what, we have a interesting sort of program that we'd like for you to potentially work on. And instead of putting like a business development manager in place, we were thinking it would be great to have a nurse sort of look at all of our programs in terms of workplace violence, like what we're doing, what kind of education we need, and things like that. So, just over 3 years ago, I sort of went in with fresh eyes, like a nursing perspective of looking for an assessment and diagnosing to figure out where are our problems, what are our risks, what could we do, and just to go out and talk to people. So that's kind of where I'm at now, 3 years in, just over, and learning how violence affects a place like a hospital.
That's excellent because you know what? Like I said, I researched for this article I wrote, and it said that there are more incidents. So what kind of things do you see actually in the workplace, and what the healthcare workers have to deal with?
So there's a lot. And one of the things that I actually teach is, people are just people. I'm a person, you're a person, and we all deal with different levels of stress. And what do people see in the hospital? Well, they see everything from just people are sometimes in a bad mood. What is that? It's kind of like, you're going in to see a family member and you just don't want to be there. Actually, I joke around sometimes going, hey, no one that works in the hospital really wants to be there. Like, we love our jobs, but there's a lot of negative stuff happening all the time. Bad diagnoses, bad news, sometimes great news. Sometimes a baby's born and everybody's super happy. But overall, the caregivers see everything from, loud, obnoxious attitudes. People just kind of closed off with arms folded, and you feel another person feels like they're being ignored. And that's pretty simple. But then you start getting into the other stuff where people just explode. They get to their breaking point. They've had enough. Um, People can become very volatile. So there could be just shouting and screaming, people attempting to punch you in the head, or a big one that we see, not just where I work, but everywhere around the country and around the world, is shoving and pushing. Um, and sometimes it just gets very violent. And in places like an emergency department where it's the first stop for literally almost everybody, it can be a battle zone. And that's what it looks like at emergency departments literally everywhere, is really bad days, and people explode and they just get into a lot of rage and aggression. And I think most of it is actually accidental.
What do you mean accidental?
Well, like I was saying, most people, when they go into the hospital, they didn't plan to go there to say, let me punch my doctor in the face. They just accidentally end up there because they say something and they perceive the other person isn't listening to them. They're in an unfamiliar system. They don't understand how all this works. I don't understand what people are trying to tell me. Is that good or bad? And then when someone says, no, I'm sorry, you can't do that right now. We're just trying to keep safety in place. Like, no, we don't want you to hurt yourself. But we say, no, I'm sorry, you can't do that right now. And that pushes a person to just want to fight back. It's kind of
Right.
like a caged animal. If you keep holding them back, the more and more you do, the more they're gonna just want to pounce.
Well, a couple of things you've said already. I had to go to a local hospital yesterday to see a very good friend of mine. We've been buddies since seventh grade, and always an active, vivacious, outgoing kind of guy. Family guy, had all his kids and my kids all got along. We camped together. We had all this stuff. Well, out of nowhere, we both hit our 60s, and I hadn't talked to him in a while. And he calls me up and he says, "Hey, just want you to know, just been diagnosed with stage 4 lung cancer, and I don't know what's coming in my future, but it's scary, right?" I talked to my doctors. Now, this is the kind of guy that he is. Like, I was shocked to hear this, and I said, "Well, stage 4, that doesn't sound good." He goes, "Well, I talked to the first doctor, and he said it can be a 2-year diagnosis, and I can be gone in 2 years." He goes, "So I went to another doctor, and that doctor had a little different perspective on it with care. He says it could be 6 years." He goes, "So I'm going to go with the 6-year guy."
Hmm.
I'll take 6 years instead of two. Now that sounds funny, but that's really, he had a good attitude about. But I had to go there yesterday, and I can tell you, I went in excited to go see him, because he passed out or something, and they are trying to hold him to figure out what's going on. So I go in, and as I'm going in, what you were saying is about, it was scary going in, because here's my friend who has this deadly diagnosis, and as I'm leaving, I can't say I wasn't depressed. I was saddened for my friend going through this. But then as I saw a young couple in the hallway, they were leaving with their baby. And I'm like, what a powder keg healthcare places are, because on one floor you got people dying, and another floor you got people being born. It's really a microcosm of life. You have this beauty and excitement of a new baby, and then here is someone struggling, and all of that was pretty obvious to me. So when you said that, that actually hit me, because I just experienced it yesterday. I think when you talk about the frustrations of people, and this is where I think you can address this for me probably better, is I know I've had to go to the emergency room. I remember I was working in my yard, right? And I was lifting fences and all this stuff. I went to bed and I woke up with chest pains. And I'm like, it's not a heart attack. It's something else. And I didn't associate the work I did. And it went on for a very, very long time. Um, and finally, I got panicked. I scared myself into it must be a heart attack. And I drive myself to the emergency room and I walk in and there's 90 people there. Now
Mhm.
I'm thinking I'm dying. And I'm trying to get the woman's attention behind the desk. And she's, talking to everybody, saying, "Hello, I think I'm having a heart attack." And she goes, "What makes you think that?" "What do you mean, what makes me think that? I got chest pains. This is what they tell you. You got chest pains. Come to the hospital. I need somebody to take a seat. We'll be with you in a minute." And I got to tell you, I was scared because I'm saying they're not realizing that I might actually, this has been going on for 3 hours. This is not something that happened 2 minutes ago. And I got annoyed and they're calling other people. And I have to admit, they did send somebody out rather quick. Probably within 15 minutes, somebody came out and said, "Who's having a heart attack?" And I said, "Over here." And they took me back. But I could see that frustration when you go in that you're right. You don't feel like you're being, I didn't feel like I was being heard. I'm trying to say I'm having it. Well, you know what? Everybody in that room was having an emergency, you know?
Yeah,
And
exactly.
what can we do about that kind of stress? Because I think that's touch point one for violence in that
Mhm.
emergency room. What do you suggest that other people are listening? What could we do in that emergency room to alleviate that? How do we maybe make people feel they're being heard? Do they need
Mhm.
more personnel? I don't know.
So, being a nurse, yeah, one of the things that we usually always say is, yes, we could use more staff. And sometimes that's actually true. Sometimes we just do need more staff. But some of the times I've looked at it before when we needed more staff, we got more staff. And then, the next thing we said was, we need more staff again. And it just turns into that as well. But one of the major things that came up, and I used to be, I like to call it like an accidental instigator. It was until I realized the joys and the intricacies of interpersonal communication was really important. And it took me a long time to do this. So one of the things I actually teach healthcare providers and even students when I'm teaching clinical and things like that is to listen. And that seems to be easier said than done because sometimes it's hard to listen to other people's stories. So the way I do it is we have to really have our ears open and we kind of have to stop and pause and actually listen to a person because even though to me their story is not maybe not really important, like if I'm working in that emergency department and I'm doing triage, like, yeah, actually, chest pain is honestly one of the first things we need to address that like right away. And 15 minutes is unfortunately kind of a long time. But unless the building was collapsing all around us, then I could see how 15 minutes probably would have been okay. Outside of that, we probably need to have you wheeled in and we need to start assessing right away. But what I need to do is listen to the entire story. And I really only need to give somebody 20, 30 seconds to continue telling me their story. That could be listening to Lieutenant Joe tell me about his chest pain and me listening with my ears and actually looking at the individual. It's hard to do. Um, I also try to tell people don't try to jump to the end of the person's story. Actually, just stop and listen to the whole thing. And where we're at is, if you think about this of your story, you're not violent at this point. You're not being aggressive. You're just concerned. And if we can sort of interact with people early, everybody just kind of wants to make a friend. They want someone else to hear them. So I like to say, keep your eyes open, ears open, and start listening to the entire story. It's hard to do. I used to accidentally instigate people, but I start making sort of a bullet point or bulleted statements that the person made to me so I could replay them back, so I can
Mhm.
reconfirm back with them what they just said. And I found that that has been super helpful, at least in the earlier stages of talking to people to stop violence and aggression earlier rather than later.
Yep. Now let's deal with that. And you're right. It's connecting to that person. So I'm an FBI trained hostage crisis negotiator, right? I went to the FBI. I learned how to do that. I did that as part of my career in law enforcement. And what I found is what we called it was active listening skills. right?
Mhm.
And even when I teach interview and interrogation skills, one of the things I find with people in my profession, the law enforcement officers, is that they do want to jump around. They want to control the conversation because they have what they think they need to do, as opposed to listening, because people will tell you what you need to know. You can pick up a lot on their tone. You can pick up on the words they use. Words mean things. How are they saying their phraseology? So that whole idea, that whole concept of listening to somebody, I think is great. My concern in my situation, had somebody simply said to me, okay, we understand you have some chest pains. We're going to get you back in a couple of minutes. Okay, I would have, okay, they're going to take care of me. Um,
Mhm.
and like I said, they did get me pretty quick within 15, and it was 15 minutes because I was annoyed about it that I'm saying, if I'm dying, what's going to happen here? But recently, my elderly father-in-law fell in New York City and busted his face up pretty bad, and we took him to a hospital. And this is where, here's the difference now. When it was me and I was concerned about my health, I wasn't concerned about getting angry. When I was there with him, and here's an old man bleeding from his face, all swollen up, and they're telling me, I went up, can somebody help the guy? We'll get to him. Sit down. Now I'm
Mhm.
annoyed.
Yeah.
Now I can feel that anger go, wait a minute, what do you mean I know people are sitting here. They're all sitting here in chairs. This guy's bleeding from his face. Could you please help him? And they were not very courteous about that. I could see they're talking about me like I'm going to be in trouble, but I was just frustrated because nobody
Yeah.
took the time to just walk over and look at the guy. Now I get it. The manpower or people power is always, it's a cost, it's a budget concern. But I think the hospital I went in yesterday, they had a greeting area when I walked in, and there was four people behind this desk, and they went pretty quick. Hi, how are you? What are you looking to do? How can I help you? And I was like, oh, I want to go see my friend. Perfect. Go to see Muriel over there. She's going to get you signed in, and you go right up. It was very smooth, and there was enough people that all of us coming in were addressed rather quickly. That felt pretty good. So I think you're right about that. Let me ask you this. One of the things that I've learned to do is, after I left law enforcement, I went to a school district as a director of security, and I had no idea the things school people have to put up with violence. Now, every once in a while, you hear about a student that goes off. Didn't realize how often kids do that. They lose their minds. They're turning over tables. They're screaming at the teachers, and how many times the parents come in complaining, and then they start to get aggressive and angry and do things. So I created a program for them. It's a de-escalation training, not necessarily hostage crisis negotiating, although it's all interrelated. It was called Crisis in the Classroom. And it was for every member of the staff, because you never know who's going to come across somebody who's in a crisis, a mental crisis, or being upset. And everybody there loved the training. They all said, we never had anything to help us. This was really good. And it expanded out. And now I teach it all over the place.
Mhm.
Is that something you do in the hospital? Do you do de-escalation training for people so that people know how to talk to people?
Yes, absolutely. And when I was new at this role of looking at workplace violence, and I also have to say, I always tell people, yeah, I work with workplace violence at the hospital. They're like, and they look at me going, oh, and I go, oh, prevention, workplace violence prevention, that I joke around with. But yeah, I think we had to learn how to work on de-escalation first because you can put all of the other things in place on how to defend yourself in case something does get out of control. But what was interesting is a lot of people had said, yeah, okay, cool, I can learn how to defend myself, but I'd like to figure out how not to get to that point. And I'm like, yes, I agree. And that's where the de-escalation training came into place. So in the hospital, it's really important because we could prevent a lot of people getting upset by just listening and learning how to de-escalate people. And part of that is actually recognizing sort of where in the, I don't know, where in the circle, where they're at in terms of their level of anger, aggression, upsetness, whatever word you'd like to enter. So I
Yeah.
think it's really
And,
important to use.
and I'm glad to hear that, because one of the things that in the course, when I teach the course, it's you have to understand what you're saying, where the person is in that cycle as they're building up. How do you see where they're at so that you can intervene before there's violence, right?
Hmm.
So another article that I wrote that really took off pretty good is called "Can We See Violence Before It Erupts?" Right? And in many instances, whether it's an active shooter event or somebody really going off, we can, because people don't wake up on a Tuesday morning and say, I'm going to go to the hospital and I'm going to shoot up the hospital, or I'm going to attack a doctor. There's precursors to these things that build up. And if we see them coming, if we look for the signs, we can often intervene. And that's the best. Prevent violence is much better than having to, secure yourself or fight back
Hmm.
when things start to go bad. And what I say to all of these people that are listening, I'm saying the thing you have to understand, of the number one thing when people go off in de-escalation, is because they don't feel they're being heard. In
Hmm.
every one of these situations, whether it's at home and there's violence at home, or they're out in the world and they start to get upset. I said, so one of the things when I teach people that words mean things, and I try and tell them, think about this. You're with your significant other and you start to have some kind of an argument, and you turn around and you say, calm down. Now that's in the joking world. Everybody knows how well does that work when you say that to your significant other. It works zero times. What does it do? It amplifies the problem, because you're now giving, I call it an action imperative. You're telling
Hmm.
someone to do something and you're not listening to them.
Right.
So the other side of it is, I talk about me and Mrs. Lieutenant Joe. We get along wonderful for many years, but every once in a while we get into a little thing, and it's normally my fault. Okay, it's usually I wasn't caring, I wasn't thinking, I said something I shouldn't have said. I get it. I understand that over many years. But I have learned that over the course of time, the best de-escalation tool is for me to stop myself and listen to what she's saying. She's hurt, she's upset, and I don't think she's right to do that. And then I say something back, and it builds. So instead, what I've learned to say is, I'm really sorry I said that and that it hurt your feelings. And what happens when you acknowledge someone's upsetness? They calm down. That's
Hmm.
de-escalation. Listen, you sound really angry. So some of the techniques that I'll throw out there for people is what we use in our process. Is there's what we call the behavioral change stairway. So if you picture a stairway, and the bottom is the beginning incident, and at the top is the behavioral change you want. So if someone's getting upset and angry, you want them to calm down. How do we get there? Well, we have to understand where we are in that process. So your point is perfect. When I see somebody, and what do? You build a rapport, you interact, you listen to what they're saying, and you try and see if that has any reaction. One of the best ways is to help people vent what's bothering them or why they're upset, right? So I always say, think of a person who's going in crisis and getting upset like a red balloon. And the more upset they get, the balloon gets bigger and bigger.
Yep.
And what happens eventually when a balloon keeps blowing up? It pops. And then you have violence. So the idea is, how do you de-escalate that, deflate that balloon? So one of the things we use is what's called emotional labeling, right? If you hear an emotion, you say it, because as human beings, we react to the emotion. If we hear it, somebody says it, we react to it. So if I say, Christopher, boy, you seem really angry today, and you're angry, you'll say, you're right, I'm angry. I've been waiting in line here for half an hour. I got my father-in-law here, and nobody's helped me. Boy, you sound frustrated that nobody came right out. I am frustrated, right? Likewise, if you're not angry and I say it, you'll tell me you're not. You sound really angry. I'm not angry. I'm just really frustrated. I've been sitting here for an hour. This guy's an old guy. I understand, right? And that's how you de-escalate, right? So we emotionally label, we hear it, we say it, and it helps us to help let people vent, because when they say, you're hearing me, right? And they go down. So the other thing that we do is, as you're talking to somebody, sometimes there's a lot of facts they want to throw at you, right? This is going on, and I'm not this, and it can be confusing. And then you turn around and you're listening to somebody, they're all upset about their relationship, and that's why they're in the hospital, because they got beat up. And you say, boy, so you're trying to tell me that you have a bad relationship. No, that's not what I'm telling you, right? Because you're not listening. So I say paraphrase once in a while. All
Yeah.
right, so Chris, what you're telling me is that you had this problem at home, it built up, it turned into violence, and you come in here because you want not only take care of the bruise on your face, but you want to see if there's any resources to help you not have a problem at home. Is that what you're saying? Yes, that's what I'm saying. Excellent. You're hearing, right? You're hearing them, they're hearing you. So those are some easy, simple techniques that people can
Mhm.
use. But the key, you're absolutely right, is to prevent that violence from happening first. So
Right.
I want to hear a little bit more about that. We're about to take a break. So, all our producers in the background, they're going to start waving their hands at me in a minute. Do you also do, and we'll get into this when we come back, I mentioned it a couple times. I didn't realize the threat of active shooters. I know in schools and businesses it's very high. You must have that in hospitals as well. And we all heard about the person who shows up at the hospital and kills their spouse and then kills themselves. And sometimes they take out a doctor or a nurse while they're doing this. So I'm going to assume that that's a reality more than we probably know. And I think we'll talk about that when we come back. So I want to thank you for being here, Christopher. Uh, we'll be right back, everybody. Stand by. All right, everybody, welcome back. What I say all the time, Matthew McConaughey. All right, all right, all right, all right. Because I like to say that. I wish I had said that. That's kind of funny. All right, so Christopher, um, let's talk about that a little bit. Is there concern in healthcare locations for active shooters? And let me preface this by saying, when we think of the number of active shooter incidents in America, they have doubled since the pandemic. And we're
Mhm.
all worried about schools because they're the most innocent of people, kids, right? We got our kids. School shootings, active shooter incidents, are really only one third of the total. The other two thirds are in every other place where we gather, where we work, where we go for fun, where we do things. Do you see this in the hospital? And if so, how do you prepare for that?
Well, yes, in the hospital, in all hospitals, certainly active shooter is a topic that we're sort of always worried about, or at least thinking about. And it is part of our
Kathleen Pangaro.
ongoing education. So, all various hospitals will all have some sort of code system. So we all receive training on this every year, and it's always a question of how good the training is and the education. So most individuals will know about run, hide, fight, the three pillars in order to stay safe. And it's something that I personally think about too, because the world around us isn't necessarily getting better in terms of gun violence and things like that, especially in the hospital. What we do know is it's a high risk area because high stakes, things are always happening. And even just recently, like in Pennsylvania as well, that hits close to home. Um, to most caregivers, that there's an active shooter, there's a hostage situation, and literally all of us could say that could happen where I work. It's just a matter of time. And that's the scary part. So, one of my things is going on an adventure maybe, of trying to get people to think about don't be, yes, be frightened of it, but I don't want to be necessarily scared of it. I want to have a plan. I want to know what to do if this actually happens. And I sometimes sit in classrooms and I have a special video that I show people that really fully prepares them. And it can be a little bit overwhelming. It's not a gruesome video, right? But it sets people up to see the reaction. And even myself, every time I watch it, because there's people in it acting that I know, it makes me go, oh, geez, like it still worries me. But the difference is the people that I've shown it to said, I have a plan. I think I know what I need to do in my environment to get out safely or to protect myself.
I think that's great because one of the pillars that I focus on when I go to any organization, and I've been to, big businesses, TV studios, newspapers, companies, warehouses, all over. And a lot of places do watch a video, um, but they don't. really follow up with anything else. It's like we check off a box, check off a box, and then something happens and they say we're not prepared. So I went to this very, very large company and I went in and I did an assessment for them. They had a brand new building. They had just created it. It was fantastic. They wanted me to come in during pre-construction so I could give them some pointers on where they should put all their stuff, which they didn't do. And they ended up having to do some retrofitting after I came in and said, well, it's great. You have this beautiful entryway, but your security booths are all over there and your security people can't see who's coming in the door and they're already in your building. So it was interesting. But when I talked to employees, I'd go around and say, okay, have you been trained in active shooter? Well, yes, yes, we watch this video. It's very scary, but okay. Where would you go and lock down or hide in this building? I don't know. Nobody ever told me that. Well, what do you mean? Yeah, they told us to watch the video, but we never actually went anywhere. I don't know where I would go. I have no idea. So
Mhm.
interesting story. I went to this large company and they had three floors of employees, and each one had about 200 employees on each floor. And they had cubicles, right, on each floor, and all these people. And I trained them on what they should do. And the owner was excellent of this company. He goes, okay, I want to do an actual drill. I want people to get up out of their chairs and see if they can do what you taught them to do. I said, okay, so we'll do that later in the day, right? Yeah, okay, that'll be good. So I told her we're going to do a drill later in the day. I'm not going to tell you when, but keep in mind what we just talked about. So a couple hours later, went to lunch. Everybody came back. I sent in a role player who had a fake shotgun, but it racked, the universal oh crap
Mhm.
sound,
Yeah.
that shotgun. And he ran into this room screaming, and all these people got up, and there was four exits off the floor. 90% of them went to one exit, and they
Mhm.
bottlenecked, and they were stuck there. And the shooters, the guys just walking up to them, racking the shotgun. Me, obviously, everybody knew you'd have been killed. A couple of people ran to another doorway, and some people hid under their desks. And we got done. It was traumatic, but it wasn't because these things can be traumatic. You have to. That's one of the things you have to prepare for. You know, to just think about it. What are you going to do? And we did a debriefing of everybody. And I said, okay, why did most of you run to that door? And they said, well, that's the way we always go. That's how we go every day. I said, what about the other three exits? Never thought of it. I always go that way. Did you
Mhm.
see the problem? Yes. As soon as that guy kept coming, and I couldn't get down the stairs, and I was like, what am I going to do? So why'd you go under your desks? Because I saw the pile up and I ran. Why did you go for the other door? Because I said, there's another door, right? So some people were thinking in the moment whether they
Yeah.
would have survived or not if you actually had somebody shooting. But the thing was that they didn't realize that that would be their reaction. So I let it settle. The owner called me about 2 months later. He says, I want you to come back and do another drill. So we came back. He told them on this day there'll be a drill. Mid-morning, we did the same kind of a thing, sent a guy in screaming and hollering. This time, probably almost equal. People went to different doors. Not everybody ran that, and we debriefed. I said, why'd you do different than the last time? I didn't realize last time. And now I know, well, I'm going that way because most people are going to go that way. So I'm going to go that way. And they ended up, the number that would have survived went way up. So you're right. Having a plan and actually working through the plan is extremely important. Um, we all know fight or flight, right? Fight or flight. The lion jumps on the trail. You either fight the lion or you run. What we don't realize is that there's a third part of that equation. There's fight, flight, or freeze. And if we don't know what to do, the chances of us freezing or making the wrong choice goes up exponentially. So what I say, I like little sayings. You'll see I got a lot of sayings, Christopher, to help us remember stuff. Is that you don't want the first time you have to do something, especially to save your life, be the first time you thought about it, right? So
Right.
that's why we have to think, talk about it, plan, and actually do things so that we know how
Mhm.
to survive. And the whole idea of being paranoid, we can be scared to death over this. This is scary stuff, somebody coming to kill you at your workplace or killing your kid in school. But the reality is, if we practice it and think about it, we become aware and we prepare, and then we
Mhm.
can survive. And that is an empowering thing. My training is all about empowering people to go, I could survive this if this happened. I could get through this. Is that part of what you do?
Yeah, that's ultimately what I do as an educator and working with workplace violence. So, one of the things that we tend to know, and this isn't just where I work, it's literally everywhere in healthcare, is that we work in an environment that's super busy. And we have a punch list of things to do. We don't usually have the ability to go, I come into work and I just get to hang out for 8 or 10 hours and go home at the end of the day. We have a lot of people to treat. We have a lot of people to see, tasks to do, orders to follow, medications to give. And what that does is makes people begin forgetting about their awareness. They start forgetting that they have to think about their safety. And what ends up happening is, me as a caregiver, I hear someone scream or yell. I'm usually like, whoop, I'm dropping what I'm doing and I'm going straight to it. But because I'm running in because I heard the screaming and I didn't sort of pre-plan, which only takes humans a quick second to know what I need to do. But I go running in the door and I don't realize the screaming has nothing to do with someone hurting. It's because they're having a situation of dysregulation. They're having maybe a behavioral crisis, and I run right into danger. And this happens with a lot of caregivers. So we have a lot of, I teach pre-planning all the time. It just takes a moment. I sit down sometimes with classrooms full of like 30 or 40 people that work in places like an emergency department. And the emergency departments are gigantic. There's lots of nooks and crannies, and there's a lot of glass and open areas. So I tell people, what if the unimaginable happened right now? Where are you going to go? And I go, pick a pod, pick an area, pick a department. And I go, where do you work? And they'll say, oh, I work on this floor. And I go, okay, where's you go to right now? And they go, I go, too long, too long. Where are you going to go? And they're like, I don't know. I haven't thought about it yet. And it's like, that's what I would love for you to do today. I want you to think about the place you're going. And I go, guess what? You work there probably 95% of the time. And in hospitals, guess what? Individuals get floated every now and then. In my environment, yeah, I have my office, but I go everywhere. I see units all over multiple campuses. And sometimes it's just a place like a cafeteria. I'm like, oh, I haven't been in this one yet. So what do? I tell people when you go into an environment that you are not 1000% familiar with, make a note of the exits, quickly look. What would I do? And then that's it. Your brain goes back to having a plan. So if the unimaginable happens, your brain kicks back to, I need to figure out where to go. Where am I going to go? And that's the first response instead of, oh my God, I'm going to die.
Yes.
Um, and I've told people I do that. I've done a mind over matter exercise. Like you can tell, you could make yourself prepared by preparing ahead of time. If you just tell yourself, this is what I'm going to do, this is where I'm going to go, this is my exit, this is my strategy, it increases your odds of surviving something, a terrible calamity.
It absolutely does. And this is, I think about, when I talk to different groups of people, because unless I'm talking to law enforcement, people who deal with life and death every single day, you kind of get used to the fact you carry a gun everywhere you go. You're kind of used to that idea you can be involved in that thing.
Mm.
Everybody else, you don't think you're going to go to work and get killed or you're going to go to work and get injured. And some people have never been around any kind of traumatic event. They've never been involved in violence. They've never seen a weapon in the real world. And one of the things that it's exactly that. So I'm glad to see that you're doing more than that. But I knew that that you would be that kind of person anyway, that you would do more. But when I see these places that say watch the video and then sign the form electronically, and that's what they've done. They've checked the box. That's not enough.
Yeah.
You telling your people what you're telling them is situational awareness. Be
Hmm.
aware. And again, you don't have to be paranoid. You have to be aware and prepare. So when you go in and you look around at a location, if it's a new location, pay attention. Where are the exits? Where could I go? I don't know how many people I've said this to over the last, that's 20 years now. I said, I used to get on an airplane and sit down. Now I get on an airplane, I look around.
Hmm.
I want to see who's on the plane with me. Is somebody getting out of control? Are they starting to run their mouth? How would I protect myself if somebody did something stupid on this airplane? Well, we're
Yeah.
all conditioned for that because of 9/11. right? We saw
Hmm.
what happened, and now you think a little bit more. It's a matter of thinking a little bit, what could I do? So when I go to facilities and, when you think about your policy and procedure, sometimes I write policy and procedure for lots of organizations. And what I see is that they will come up with a policy that says, if there is this, you will do this. And okay, there's an active shooter, then you will go out immediately out the first door and you will flee and this and well, if that's your policy and there is an event and people do anything other than that policy, they're in the wrong. If they
Hmm.
get hurt, it's all kinds. So what I talk about all the time to people is you need to have multi-optional responses to things, right? You could say, here's what we suggest is the best thing for you to do. But if you can't flee the room, then you can also lock down. You can fight back. You can do whatever you feel you need to do at that moment. And you train them in all of those different aspects. Because if you just lock people into one policy, and it seems like, well, I told everyone how to survive, that's our policy, and they do anything but that, they're out of policy. And I hate to talk about liability when it comes to a violent event, but there always is. The hospital can't survive the lawsuits if they're going to get destroyed in the courts, or the school gets destroyed. It's a reality. Anybody gets injured, there's a lawsuit, and the courts are going to say, could you have imagined this would happen in this modern age? Your answer has to be yes. Well, what'd you do about it? We told everyone they should run out the back door. Well, that's not a good policy because the bad guy was at the back door. So you need to
Yeah.
have other things. So multi-optional responses are important,
Hmm.
and situational awareness is really that's the best thing I think you can do for yourself when you go to a new place or you're in your workplace. Because you're right, most people do work in the same place every day, in the same area of a building or whatever. Get to know that building inside and out and say to yourself, what would I do if something happened? So I try to throw some levity in to my lectures when I do this because it's scary stuff and it's very heavy. And, you don't want people, their hearts racing. Then they got to go to emergency room and then they're all upset and then they got to deal with you, right?
Hmm.
So when I talk about this, you say, what are some things that we see out there? I said, okay, situational awareness. If you hear funny popping sounds, what do people do? Well, they get up to go see. What's that funny popping sound? I said, if you work in an environment where there are no funny popping sounds, you should assume that that might be gunfire and say to yourself, well, unless you work in a fireworks factory, there's no popping sounds in my workplace. But all of a sudden I hear this popping sound. You should consider that might be gunfire. What should I do? Right. So a friend of mine, I went to this business and I taught them all situational awareness and active shooter response and what they should do and this and that and listening to their community, their area. And it went well. Everybody liked it. About, I don't know, within 6 months, the guy takes his wife to Arizona for a vacation. They're eating at a beautiful outdoor restaurant. The tables are all lined up. There's about a 3.5 foot concrete wall next to their tables and beautiful downtown area. And they hear this boom, 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 boom down the street. And the wife says, "Oh, what's that? You think they're having a parade?" And the guy says, "I don't think there's a parade coming through downtown. I didn't hear anything." And boom, boom, it was getting louder. She goes, "Is that fireworks?" "There's no fireworks at 2 o'clock in the afternoon." He says, "Get up." She says, "What? Get up." They left their food. They went over that concrete wall and they went around the corner.
Hmm.
Within 30 seconds, the guy with the AK-47 came around the corner and was lighting up the tables. And this guy calls me. He goes, "You saved my life. You saved my life." I couldn't believe it. I said, "I didn't save your life. You saved your life. Why?
Did it
Because you
yourself.
paid attention. This isn't
Hmm.
right. They're not doing fireworks. Get up." He goes, "And I remember you saying that. Unless you work in a fireworks factory." And it was funny at the time, but that's what he remembered when he heard that funny popping sound. Get up and go. Right? So people will do what we teach them if we give them and empower them to survive. Right? And that's really what a lot of this is about. So I think
You
that's
know,
excellent.
Joe, what's interesting is I did that about 3 years ago when I was on this new path of figuring out and doing an assessment of an environment. I went to an area where I was working with some friends, and I said, I did a similar kind of thing. I said, so I was like, guys, tell me, because I said, I wasn't planning, I never prepared for this. So I said, imagine you heard what sounds like how you described it. Like there's these like bang, bang, bang noise, and you're like, oh, that kind of sounds like, and people went, a gun? And I went, yeah. And I go, what are you going to do? It's coming from that far corner down there. It was interesting to hear many times people said, I'm going to go investigate. And that's the nurse, that's the healthcare provider
Mhm.
saying, I got to go and figure out what to do. I got to secure this area. And at that point, I'm like, that's probably the most deadly thing to do. You have to start your planning. And that's what made me realize that people weren't planning, they weren't preparing ahead of time. But now when I go back to tell people, I tell that same story. And I ask people, what are you going to do? And I love it now because people go, "Zoot." They point out an exit. They go, I'm going that way. They're like, I'm getting down and I'm army crawling my way out the back door. And I'm like, oh, so it sounds like you guys all have a plan. Um, and I drill people with this, and what shows is that people in their mind have prepared differently than they did 3 years ago when I asked people. Now I don't get anybody saying, I'm going to go investigate. So I use it a little bit as a funny joke and people laughing. And then
Mhm.
I'm like, they're good friends of mine. They just didn't plan.
Right.
And I would probably still be in that same predicament, not really planning.
Right. And I tell you that, and that goes right to my little sayings, right? That's why I have these little sayings because they're cues. You don't want the first time you have to do something be the first time you thought about it. So
Exactly.
if you think about it, you have someone like you who's asking them questions, challenging that thought. If we make security a part of what we do, as opposed to just something we have to do once in a while, if we make it a part of our lifestyle and when we're in locations, consider, you're right, the world is not getting better. It's not getting more safe. It's getting worse. Like I said, since the pandemic, real shooters incidents have gone up, doubled. Not the gangbangers in the neighborhood running through your parking lot throwing rounds at each other. That's not that kind of a shooting. That's a shooting, but it's not someone attacking the hospital. It's not someone attacking the school. Those are specifics. Those things have doubled, right, since the pandemic because we're all poofed up in general and things are getting worse. One of the things that I like to use is statistics.
Hmm.
Now, statistics are dry and they're boring and this and that, but if statistics can help us respond, I have find that giving, knowledge is power and it's helpful. Just like telling someone, you hear a funny popping sound, if you don't work in a fireworks factory, you got to assume that could be gunfire. Well, when I give the statistics of active shooter events across the spectrum, I say most of the time, 94% of the time, it is a male that's doing the shooting. 96% of the time, there is one shooter, right? How does that statistic help you? Well, if you know that 96% of the time there's only one shooter and I hear gunshots over there, that tells me that's where the shooter is. I should go that way. Does that mean that there couldn't be two? No, of course it doesn't mean that, but where's your odds? Your odds are I hear gunfire over there, I'm going that way. And having people understand the statistics of who's doing what and how these things unfold, what has happened. So case studies are very important. When you talk about an incident that happened in Pennsylvania, I guess that was at a hospital, you look at that and you say, what can we learn from that incident? How did people react when this happened? What were they prepared for? So there's a whole gamut of this, and it all comes down to preparation, right? So again, I keep throwing out my articles, but these things move me, and I write them down. So an article I wrote that was pretty good, got a lot of play. Is called "The Three Pillars of Survival," because there's so much stuff here for us to talk about. We just talked about for an hour about all these different things, and we haven't even touched the surface.
Mm.
And people can get confused and overwhelmed by, well, what else do I need to know? What else should I be? So I said, how do I help and break this down into a formula that people can use? And I said, okay, the three pillars of survival really come down to these three things. And if we concentrate on each one as much as we can, we'll be better off. So the first one is preparation. We have to prepare, do an assessment, figure out where your security gaps are. What kind of equipment do you have? What kind of training do you have? What do your people know? What have you gone over? You prepare as best as you can. Then the second one is communication. How do you say you're standing in that emergency room and you see a guy in the parking lot coming towards the door with a rifle? How do you tell everybody else in that facility? Lock down, run, flee. There's danger coming, right? How do we communicate to everybody? What are our practices there? Do we ever test it? I can't tell you how many places I go, oh, we have intercoms. And I talk to the people, yeah, the intercoms don't work. They haven't worked for years. We count on cell service. How's your cell service? It's terrible inside the building, right? What are you doing? That's what you're counting on, right? And the third pillar is notification. How do you call the good guy and good girl guns to come and help you? How do you reach the outside world and say, "Hey, we have a problem here. Please get here." Right? If you have on-scene security, how do you notify them? If you're waiting for the police, how long does that take? Have they ever come? One of the things I find is the officers don't always know the facility. They drive by it every day and they go there for a call once in a while. But if you said, go to the lunchroom in the cath lab, they have no idea where that is. How long time equals life in dangerous situations. They have no idea where these places are. So invite them in, have them walk around, have them go see things, right? So, Chris, I want to thank you. I think this was excellent. I know you just did a program on this. Obviously, you got your head wrapped around this, and people are very, very lucky there at UMass that they have you. Um, See, can you give me if I'm a facilitator in a healthcare place. What are a couple things I should consider right away telling my people about safety and security?
Um, Luckily, where I work, we have police, armed officers right on site on our campuses. I think, if you are working at a hospital and something you'd want to do is if you don't have security available on site, would be to touch base with the local authorities and get them to possibly come through and understand what your facility is like. They probably only know the emergency department waiting room and they don't even really know how to get into the rest of the hospital or where anything is. I think that's probably really good for just even a small little healthcare facility, like a doctor's office, things like that, with, 20, 30 employees. It might be good to touch base with them so they understand all the workings. Um, for everybody else working in healthcare, I think the number one thing really is to understand and become aware, opening up all your senses and knowing your surroundings, and then also prepare and just be able to have a plan in place. That's usually my go-to for people, and that's the first couple of pillars to staying safe.
That's outstanding. All right. So everybody out there, no matter where you work, your workplace should be healthy, fun, enjoyable, open, warm, welcoming, so you can do what you do. All right. Especially in healthcare, you're there to help people. That's what you're there for. Just like schools, they love these kids and everything, right? But being prepared, look around, ask the questions, and do these things. Christopher, I want to thank you for being here. I appreciate it. Everybody,
Having me.
whole world, Christopher, the whole world. Nice to meet everybody. An absolute professional, and my absolute pleasure of having you here, Chris. Let's get you back on again in the future. What do you think?
Sure, sounds good. I'd love to.
All right, everybody. We'll catch you next time. Remember, be a part of the solution, not a part of the problem.